Medicine can cure disease, but only doctors can cure patients. A very warm good evening to everyone. I, Pranjal, welcome you all in this really special session. Do you think that doctors play a very important role in our lives? Of course. Doctors are responsible for increased life expectancy and improved well-being in the society. People who survive diseases such as cancer usually owe their survival to the doctors, whose skills and dedication are vital for the cure. It's our utmost pleasure to have one of such great doctors among us today, Dr. Niren Bhavsar. He is MD in anesthesiology and at present working as chief anesthesiologist at Sims Hospital, Science City Road, Ahmedabad. He's leading the anesthesiology program for heart, lung, and liver transplant, as well as heart surgery and interventional correction of structural heart diseases. His team has performed almost more than 100 organ transplants. He's a part of the largest and most structured heart team. Apart from performing almost 1,000 heart surgeries and 2,000 cardiac cath lab procedures, his team leads in implanting heart valves without surgeries, treating heart problems of smallest of the babies weighing 700 grams and most complex of heart surgeries. His center is the only center for heart transplant in the state of Gujarat. He has publication in various national and international journals and delivered lectures and conferences. He's a teacher for DNB postgraduation program in anesthesiology. I heartily welcome you, sir. It's a great honor to have you with us today. Thank you so much for joining. We would like to hear a few words from your side, sir.
Thank you, Pranjal. Thanks, first of all, for such an elaborate introduction. Actually, I don't read this. It is my great pleasure to be with students, teachers, and parents of Calrex Public School. And I'm very much happy for the topic you have shown interest in is organ donation, because it is a very noble cause, and as so many patients are suffering from end stage organ failure and requires organ transplantation, it is utmost important that there should be a public awareness about the donation, and we should spread this word like through this medium of social media and webinars. So I am very glad for the topic selected.
Thank you so much, sir, for a kind words. Well, being a doctor was that you always dreamt about since your childhood?
Not really. I mean, like a normal child, I also had a lot of dreams. But okay, by 11th, 12th, I was almost knew that this is what I am going to become.
Oh, that's great to hear, actually. So, what inspired you to become a doctor, especially an anesthesiologist?
Like as you mentioned in your first sentence itself, it is very self-explanatory. So at the end of the day, it is very delighting experience to see a smile on face of a suffering person. So that is what doctors achieve at the end of the day. So that is fascinating. About anesthesiology, I would say, I'm attracted to anesthesia because it is one of the most challenging branches of medicine. Because an anesthesiologist need to know about all the organ systems, because while surgeon is operating on one particular organ, it is an anesthesiologist who take care of other organ systems. So that is very interesting. And third important thing is being a tech savvy person, I think the gadgetry of anesthesiology attracts me.
Oh, that's wonderful. It is really great to have such passionate doctors in today's world. So, there are certain questions that a lot of people ask regarding heart surgeries, organ donation, and anesthesia. It would be great if you could answer some of their questions.
Sure.
The first question is that often people don't know the importance and the exact procedure for organ donation, like the rules and laws behind it. So it would be great if you could spark some light over the importance of organ donation and the rules and laws of it.
Sure, I'll do it. But before I go for that, I would say that the organ donation is for organ transplantation. And the organ transplantations, if I talk about the most vital organs like kidney, liver, heart, and lung and pancreas, there are two types of organ donation. One is living related donation, and one is deceased donation. That is after a person is declared brain dead. So kidney and liver are two organs which can be donated when you are alive, and heart, lung, etc. are the organs which you can donate only once a person is declared brain dead. So the procedure for both this type of transplantation differs. Uh, the most important of this is deceased donor donation, because it is the family who needs to decide that they are ready to donate the organ of the deceased person. So for me, it is of very great emphasis that public should be more aware of this kind of donation. Talking about organ transplantation, actually first the donor and recipient's organs should match. So we have a procedure and we run a series of tests that both the organs have, and both the donor and recipients are compatible with each other, like blood grouping and HLA matching, and we also compare the body structure and age of the both the donor and the recipients. So for living related donor, once it is decided that a donor is identified from the close relatives, a donor should not be agree to donate by any commercial or social pressure or influence. It should be strictly voluntary. So there are legal norms also for such kind of donation. So once a donor is identified, we run a series of tests on the donor also that the organ is good for donation. About deceased donor, the first most important thing is a legal binding. The legal binding is that person should be declared brain dead. Brain dead means that his brain has stopped functioning, but other vital organs are working normally. So there are methods to diagnose brain dead, and once a person is diagnosed brain dead, family can agree upon donating his vital organs for the transplantation. The laws and rules are very strict. Uh, Government of India has laid Organ Donation Act in 1994, which is amended in 2008 and 11. And so any non-compliance to these rules and laws are very punishable offense, very much punishable offense. So yeah, it is very program is very organized.
Okay, thank you so much,
So
sir.
once the donor is identified, we retrieve an organ, and within few limited period of time, we need to implant that organ into the recipient. So that is the procedure and laws. And who are the recipient? The recipients are those people who are in the end stage failure of particular organ, say for kidney, liver, heart, or lung. So such patient needs organ donation for the transplantation, because otherwise their life expectancy is reduced and it is a serious threat to their lives.
Oh, well, thank you so much, sir, for the clear explanation about it. I hope that your answer will really help our audience get the whole idea. So, my next question is that what is the most serious heart surgery you have ever performed in your whole career till now?
About the heart surgery, actually we treat a very vital organ, heart. So from that perspective, all the heart surgeries are serious matter. So you have to be very vigilant and particular about the surgeries. But yeah, I would say that what I experienced challenges was our 700 grams baby, which we did the smallest baby on whom we performed the heart surgery. And one another is our first heart transplant, which was a very sick, critical patient whom we did a first heart transplant. So these are the few very memorable experience. But otherwise, all the heart surgeries are very vital and serious surgeries. The cardiac surgeries per se are of two types, adult and pediatric, where adult surgery is most commonly the bypass surgery we all know, and the valve replacement surgeries. And pediatric surgeries are performed for the correction of complex birth defect of the heart.
Okay. Well, that must have been really challenging for you, right? So
Oh,
here we
yes.
move towards the next question. How is anesthesia administered and are there any side effects of it?
Anesthesia, first of all, I should tell that anesthesia is of two types. One is called regional anesthesia and one is called general anesthesia. Regional anesthesia means a particular part of the body is numbed for the surgery of that particular part. While general anesthesia means a patient is put asleep and we perform the surgery. The commonly anesthesia means general anesthesia in general perception, we can say. The general anesthesia has got many components like pain freeness, sleep, and lack of awareness, lack of memory for the experience, disturbing experience of the surgery, and immobility. So, for all these purposes, we use different drugs. So, first, a large vein is secured, and we inject intravenous drugs for all these purposes and components of the general anesthesia and make the patient asleep. We secure the airway with putting a pipe in our trachea or windpipe and control the breathing. Uh, and at the end of the surgery, we reverse all this effect and the patient becomes awake and can go home. So that is the process of anesthesia. Coming to the complications, with the latest ultra short acting drugs and advances in the medical science, there are very few complications. Some of the patient feels nausea and mild vomiting after the surgery. Otherwise, there are no much side effect of anesthesia. But the criticality in anesthesia is patient's other medical conditions which we need to take care. The risk is not of the anesthesia. Risk is of the other concomitant illness patient is having. And but before complication, I would here like to uh, make a truth or show the reality of certain myths. Say example, people believe that it's anesthesia is dangerous, and some of people never wakes up. But this is a myth. The truth is, all of them wake up, and it is very safe in the hands of a competent anesthetist. Second is that the experience of anesthesia is suffocating and it is like a death experience. No, it is not like that. You are having as a smooth sleep as you routinely take a sleep, and you don't have any awareness about the event happening in the operation theater. So there is no such experience. A third is coming out of anesthesia is disturbing, but I would say like how you wake up early in the morning from a sound sleep, anesthesia is equal. So you wake up very smoothly after your sound sleep. You wake up from the anesthesia the same way. So these are myths about anesthesia, and we do not know. Mostly people do not know who is administering the anesthesia. So it is very important and vital that you must ask the name and meet your anesthesiologist before any surgery. So and tell him all your medical illnesses. Even if you don't tell to the surgeon, it is very important that you tell all your medical illnesses to your anesthesiologist. So this is what about anesthesia.
Well, thank you so much, sir, for providing such important information. I hope it is really useful to our viewers too. The next question is that what is the success rate of organ donation and is there any criteria for organ donations? So like
About success rate of organ donation, I think we are all aware that the kidney and bone marrow transplantation is very successful, and at 1 year, almost 95 to 97% of the people who received kidney transplant are alive, and at the end of 10 years, almost 70% are alive. So it is very significant success rate. Even the heart and liver are also having very good success rate, varying between 85 to 90% at the first year and 70 to 75% at the fifth year, and almost more than 50% at 10th year. So it is very successful. So organ donation and transplant is very successful programs. Coming to what was your second question in this line?
Well, like what are the criteria for it?
Okay. As I previously mentioned in
Yeah.
the organ donation, criteria is that for living related donation, the person who is donating the organ has to be very close relative or first degree or at the most second degree relative of the person who is receiving the organ. There has to be competent organ between the donor and recipient. So that is for the living related donor. And for deceased donor, first important thing is that the brain dead diagnosis has to be perfect to identify a suitable donor, and then the cross match and everything has to be done before the donation. So these are the two most important criteria before organ donation. So organ donation is very simple and very noble cause to save lives.
Well, thank you again. So my next question would again be that have you ever faced difficulties in convincing patients or their relatives when they're not mentally prepared?
Yes, uh, actually, no, we have very different mindset in our people that we have some religious faith, we have some social stigmas, we have some. There are many factors which prevent from someone from donating an organ, particularly for deceased donor donation after brain death. People do hesitate to donate, and that is the reason why we do not get sufficient organ for heart, I mean any organ transplant. And so many people who are suffering from end stage organ failure, they are deprived of organ for transplantation. So yeah, it is very difficult to convince people for the organ donation, people and family particularly for the organ donation. But we have good NGOs who does this job. Actually, a doctor directly cannot convince a family. There are some laws also that the institute which is doing transplant cannot convince a family or someone to donate the organ. So there are NGOs who does this job, and I would request all the people around who is listening this to take a pledge for organ donation, and convince more and more people to come forward for the organ donation, because you can save a lot of life. That is at the end of the day very important.
Yeah, really true, sir. So we are also getting questions from the audience too. So Miss
Yeah,
Hiral
thank you.
asks that how much time does it take for a donor to come back to his or her normal routine?
If you ask, I mean, that depends on what organ one is donating. Most common organs which are donated are liver, part of the liver, and one of the two kidneys. So these are the most common donations. Usually, we take utmost care for the outcome of donors, and they usually, after discharge from the hospital, they are back to their normal life. I mean, there is 1 week, at the most 15 days.
Okay. So even Miss Kinzel have asked the question that what is the difference between a child heart surgery and an adult heart surgery?
Well, as the name itself suggests, the child heart surgery is performed in children's, and adult heart surgery is in the adult. The difference is that most of the adult heart surgeries are for the vessels of the heart, that is called bypass surgeries, and valve replacement or repair surgeries. While for pediatric, almost all pediatric heart surgeries are for the correction of birth defect in the heart. So the pediatric heart surgeries are challenging because of the size of the babies and the complexity of the defects which are present in the kids. These are the two major differences.
Okay, Mr. Vijay asked the question that what are the precautions one should take care after organ donation?
Well, after organ donation, there are prescribed medications which they need to take and their lifestyle modification which they have to do. Nothing much. Like, depending on the organ you are donating, the doctor will advise you a few things and you have to follow those things. Uh, I would actually, no, sorry to just sidetrack this discussion, but living related donation is though very important, but the more emphasis I will put on the deceased donor brain dead donation because those are the organs which are going to be burned or buried. You know, if those organs can be utilized to save someone's life, that would be very great.
Thank you so much, sir, for answering our questions and giving your valuable time to us. The information you have imparted is really worthy to never forget. And I hope our audience will definitely take care of the instructions given by you. Thanks to our audience who have been engaged with us from the beginning. I hope this session has even helped you all enhance your knowledge. Thank you so much for being here. Again, thank you so much, sir, for your presence. Oh, well, I need to mention that we
Pranjal,
also got a little question from our audience again. Let's include it too. Well, that works. Okay. So, Namita asked the question that after a kidney transplant, will it affect the donor to live his normal life, like normally?
not exactly, because one can live with one kidney, and as long as that kidney is functioning normal, her or his or her life will be absolutely normal. So there is nothing which can affect their routine life. And you are donating a kidney for someone you love, so that matters a lot. Yeah.
Oh, okay. So, sir, what would you like to say to our audience who is watching us right
Yes,
now?
actually, Anna, actually, that's why I was interrupting you. That
No,
before we end the session, I would like everyone to pledge for organ donation. Again and again, my emphasis is on organ donation. Your family members, God forbidden, something happens to them, please do not forget to donate organs. One deceased donor can save almost 9 or 11 lives. So this is very important. Those 9 organs or 11 organs are going to be disposed of, either burned or buried. So I would request all of you to take a pledge that please come forward for the organ donation. There are thousands, lakhs of people who need organ for the transplantation. There are long waiting lists all across the globe, even in our city, even in the state of Gujarat. So please come forward and take a pledge for organ donation and help so many lives. That's my request.
well, that was a great message, sir. Thank you so much for being here. Again, thank you so much, sir, and our audience for your presence. We salute to all the doctors who are working harder and harder just to save us all. Thank you from the bottom of my heart. With this, we
Thank you,
end our
Pranjal.
today's session. Hope you all liked it. Stay healthy, stay happy.
Thank you.